The problem is expectations around surgery. But like girls don't realize like your skeleton, your frame is very hard to change. If you come in with certain problems at home, certain problems in a relationship, surgery will not fix those problems.
Keeping it real with Dr. Zach, how do you feel about the celebrities that are saying that they haven't had any work done?
I mean, I think, like when we talk about social media, it's great in that it gives us this huge community where we can all interact. The problem is expectations around surgery. Like we know people, you and I, we've had patients that, they'll give their beauty routine. We have friends that are plastic surgeons that have done facelifts on some of these people, and they do their beauty routines, and nowhere in that routine does it talk about surgery. It talks about, sun protection, it talks about eating well, it talks about all these things but the surgical side. And I think when we start to lie to people, we give them these expectations that are just, it puts so much pressure on the whole situation. Like it's unreachable. And I think the more unreachable our expectations become, even when we try to, zero them in or recalibrate them in office, I think that affects how people view their results longer term. So for me, it's not something that I enjoy, and I know we've dealt with that. It's not good.
To maintain your results, you do have to work out.
We've done a couple of these procedures now, and we're always talking about getting fit, staying healthy, eating well. I see you've been eating, your eating's clean. Now on the workout side, how's that been going? How have you been maintaining?
Well, I work out, 3 times a week. I eat healthy, and to maintain the best results, you have to work out and eat healthy.
Yeah, but your trainer, like you guys are doing what? Like more of the weight? You're doing a lot of like weight training. It's not much cardio. It's for composition. You guys have been doing real weight training.
Yes, booty workouts to keep the booty up, because we all know that, with time.
Gravity.
Yeah.
No, but like what you guys, I see like he does some upper body stuff. But like girls don't realize like your skeleton, your frame is very hard to change. There's some surgeons that are doing like infracturing of ribs, removing ribs. So what we can do is just optimize the soft tissue on that skeleton. Like once we've operated, the next thing is like making sure we're working out, getting our visceral fat, everything down as much as possible to make the waist tiny. And then we've done the BBL, just build. Everything else build out. So like I know he's got you doing like glute, like I'm sure he's got you doing glute stuff. We need to bring him on sometimes. Just let me talk to him about, let's educate the people.
What do you say about patients that, they come to have surgery with you and they say that, they feel depressed and that they're looking forward to this surgery to make them happy?
I mean, first and foremost, surgery can be it can be a transformative experience, but you should not find your happiness in surgery. Like, we're here to enhance your life, make it better, make things better. But if you come in with certain problems at home, if you come in with certain problems in your relationships, surgery will not fix those problems. So you may leave disappointed. We're not gonna, if somebody's depressed before surgery, when we talk about that, when we talk about, evaluations with other doctors and making sure that they're fine. But if somebody comes in sad or depressed, like you're gonna leave surgery sad and depressed. Like it doesn't fix your problems, And it might even be worse because post-op you get inflammation, brain inflammation, you get your mood, you go through this emotional roller coaster of healing. So it may not be the best thing for them, I think if a patient comes in thinking that surgery is the key to happiness, they're setting themselves and the doctor up for failure, period.